The views and opinions of the following show do not necessarily reflect the views and opinions of News Talk 1450 WOL, Radio 1 Incorporated, or their management.
This is Montgomery Mosaic on 1450 WOL, WPRS HD2, and worldwide on WOLDCnews.com. Montgomery Mosaic features topics of interest to Montgomery County residents, businesses, and visitors. Here now are your hosts, Deborah Milo and Ron Thompson.
Good morning and welcome to Montgomery Mosaic. I'm Ron Thompson. Deborah is out today, but we have another exciting show for you on 1450 WOL. This morning we have with us Emmett Martin, the Program Manager for Cultural Competency at the Center for Health Equity and Wellness. Good morning and welcome to Montgomery Mosaic.
Good morning, Ron.
You work for the Center for Health Equity and Wellness for Adventist Healthcare. This is a twofold question. Tell us exactly what this is and what the mission is of the center.
Sure. Overall, Adventist Healthcare has a mission to demonstrate God's care through the care that it provides to our communities. It does so as a faith-based organization by focusing on a physical, mental, and spiritual healing process. At the Center for Health Equity and Wellness, we are the hands and the feet of this mission. We're so integral to getting out into the community, touching the community, and delivering the outreach and services that help people to improve their well-being. When you see community events, when you see screenings, most of those staff come from the Center for Health Equity and Wellness. Our primary focus in delivering those programs is to also explore and bring awareness to the disparities or the gaps in care and outcomes that exist for some of our populations. In 2007, our then President Bill Robertson of Adventist Healthcare really saw the changing demographics in our local communities. And wanting to address that, he made sure that he created the center to focus on eliminating those gaps. Last year, the Center on Health Disparities combined with Adventist Healthcare's Health and Wellness Department to now become the Center for Health Equity and Wellness. And so we continue to focus on eliminating the disparities in care, but also make sure that we provide outreach and services that meet the needs of our changing populations. Our current president, Terry Ford, continues to really focus and have a passion for the center and what we do because it's integral to Adventist Healthcare's mission.
Excellent. Now, let's talk about Project Beat It initiative. All right. What is the initiative and how does it help to improve the health of African immigrants?
Sure. So BEAT IT is an acronym that stands for Becoming Empowered Africans through the improved treatment of type 2 diabetes, hepatitis B, and HIV and AIDS. About 2 years ago, in January 2012, the Federal Office of Minority Health approached the center and they tasked us with the opportunity to educate and improve the African immigrant health outcomes in those three focus areas. And they wanted us to not only address the needs of the African immigrant patient, but also to look at the needs of their providers, because providers have challenges in understanding some of the cultural nuances and just the challenges that their patients may be facing.
Okay.
So we developed a curriculum that met the needs of those individual audiences, both the African immigrant patient as well as their providers of care. And we discussed some of the things that are what may seem like common sense to those of us in the healthcare field, but maybe those people who just were newly diagnosed or are not as familiar with health challenges may not know. So from the African patient perspective, we work on prevention and treatment strategies, but we do so from a cultural perspective. So we integrate cultural nuances, cultural diets, things that are relevant to what is important to them into the treatment plan. Because as the saying goes, you can take the person out of the village, but you can't take the village out of the person. And
Right.
so we want to honor what their cultural background is and still improve their health, because we don't have to change those things that are near and dear to their hearts, but we can improve upon them.
You're listening to Montgomery Mosaic. I'm Ron Thompson. In studio with me is Emmett Martin, Program Manager for Cultural Competency, Center for Health Equity and Wellness. How long has Project Beat It existed, and how many people have participated in the training sessions?
Sure. So as I mentioned, in 2012, that's when we started with the Office of Minority Health Resource Centers task to start the program. And so it's been around since then, a little over 2 years. We started with a community focus. We really got to the community involved to come to the table and help us inform how to develop this program, how to reach the African immigrant population. And so we developed an advisory board of about 27 people. And of those 27, 26 of them were actually African immigrants themselves. We had doctors, we had nurses, we had social workers, dietitians, all at the table.
Nice.
Who understood not just the technical aspects of treating and improving disease, but they also understood culturally as African immigrants themselves some of the challenges.
Okay.
So it was good to have them at the table from the beginning to help inform the process, develop the curricula, and help us reach the community and market the program. And so since that time, we have had about 800 healthcare providers, so doctors, nurses, dietitians come to the table and receive the training. We've had about 40 African immigrant patients be trained as well.
Excellent. How large is the African immigrant refugee population in the Washington metro area?
It is pretty significant. It's one of the larger populations here in the U.S. There's about 16% African immigrants that make up the entire total population in this area, and about 127,000 people is what that equals. The majority of the concentrations of African immigrants tend to live in the catchment area of Adventist Healthcare, which is Montgomery and Prince George's counties. And so we see quite a few of those patients come through our doors.
And some of the challenges faced by African immigrants and refugees when they come to the U.S. are?
So limited English proficiency is one of them. While about 50% of African immigrants state that they do speak English and they speak it well, there's that other 50% that do not. And so that obviously is going to create a challenge and a barrier. If you or I were going to a foreign country on vacation, we could try to manage hands, gestures, things along those lines. But imagine coming to a country and trying to live and thrive with limited English proficiency. That's going to be a challenge. So that's not just a healthcare challenge, but that's a life challenge. So that's one of the issues that African immigrants face. Similarly, unemployment or underemployment based on their immigrant status. If they have the proper work visas to be able to work and gain the employment to make their ends meet so that they can tap into healthcare, that becomes an issue. Also thinking about their immigrant status. How does that affect you? What kinds of jobs are you able to have access to? Do you have access to insurance? And how does that affect your socialization with different groups and resources that you need? And along those lines, social support. What social support is available to you? Do you know it's available to you? And how do you tap into it? So those are a few challenges that African immigrants face.
In case you just tuned in, you're listening to Montgomery Mosaic on 1450 WOL. My name is Ron Thompson. In studio with me is Emmett Martin, Program Manager for Cultural Competency, Center for Health, Equity, and Wellness. So tell us about any classes, events, or support groups that you have available.
There's quite a few. Where do I start, Ron?
From the top.
Well, one of the things that we're really proud about this year at Adventist Healthcare, in April, our Shady Grove Adventist Hospital in Rockville received the Baby Friendly Award. That's an international award that is awarded by the World Health Organization and UNICEF. And in short, it states that your hospital is doing those things necessary to make sure that you're supporting moms, new moms, and babies to have a baby-friendly environment. And so it's a very rigorous process. It's very limited in the number of hospitals that actually have the award, and we are the first hospital in Maryland to receive it. So in conjunction with that, there are quite a few support groups and classes in maternal and child health that speak to the community. We also have a number of classes around Fatherhood 101 that also prepare dads, because dads are going to be taking care of baby as well.
That's right.
And we have breastfeeding support groups as well. So that's a part of our maternal and child health program. With flu season around the corner, we definitely have a number of flu clinics that will be upcoming, and you can visit our website, which we'll speak about later, to learn more about those. And we also have diabetes education classes that are regularly ongoing, in addition to Project Beat It. And they are available to diabetics and pre-diabetics as diagnosed by your physician. And one of the great things about our diabetes education classes is that they are often covered by your insurance. And so at no cost to the patient, they can come, receive education, and improve their health without having to come out of pocket for that health improvement.
That's great. That's great. In studio with me, Emmett Martin, Program Manager, Cultural Competency, Center for Health, Equity, and Wellness. A growing percentage of Montgomery County's population, as you mentioned, is immigrants. How do you train your staff to work with so many different cultures?
That's a great question. One of the things we like to say in the center is that every encounter is a cross-cultural encounter. So that's whether I'm dealing with a newly arrived immigrant from Bosnia or my twin brother or sister. Every experience that we have in this life develops and shapes and molds who Ron is, who Emmet is. Right. And so it's not necessarily to know every cultural nuance about every country or every person or every background, but if you understand and appreciate people and have a competence and compassion for people and listen and apply your competence in the way that you want to be treated as well. It's the golden rule, treating others as you would want to be treated, maybe even better than you'd want to be treated. That's really how we hone in cultural competence or culturally appropriate care and are able to meet the needs of the diverse communities that we serve here. Montgomery County, a few years ago with the 2010 census, hit a historical point in that we became a majority minority county, meaning that the traditionally thought of minority groups, Black, Hispanic American, Asian American, became represented by over 50% of the population. And that's only going to increase. We're only going to see more racial and ethnic, quote-unquote, minorities as they become the majority in our areas. And so as we look ahead towards that, as we recognize the changing diverse cultures and communities that we deal with, it's important to recognize their needs and to meet their needs.
You're listening to Montgomery Mosaic on 1450 WOL. My name is Ron Thompson. In studio with me is Emmett Martin, Program Manager, Cultural Competency, Center for Health, Equity, and Wellness. We're going to take a short pause, and we'll be right back on 1450 WOL.
News updates on the web at WOLDCnews.com.
Good morning. This WOL Traffic Update is brought to you by Heritage for the Blind. Work zone on the Beltway, Prince George's County. Today's on the outer loop after Ritchie Marlborough Road before Central Avenue. The left lane is closed. And then there's a slow maintenance construction vehicle scheduled for the outer loop through Silver Spring. So watch for a movable delay there as that gets going. Be a star and donate your car to Heritage for the Blind. Call 1-800-DONATE-CARS or 1-800-446-1234. Now your WOL weather forecast brought to you by the Columbia Bank. For today, mix of clouds and sun, highs in the upper 80s. For tonight, partly cloudy. Could see a passing shower down to about 70 for low. And for tomorrow, another partly cloudy day with a chance of a shower and a high near 89. At the Columbia Bank, you can securely deposit your checks with just a snap using their new mobile deposit service. Go online at thecolumbiabank.com to get started. Message and data rates may apply. Steve Hirschhorn for News Talk 1450 WOL, where information is power.
1450 WOL.
Right back at you with Montgomery Mosaic on 1450 WOL. My name is Ron Thompson. Deborah Milo is out today. In studio with me is Emmett Martin, Program Manager, Cultural Competency, Center for Health, Equity, and Wellness. Some local populations exhibit different health beliefs, practices, health-seeking behaviors that are different from our Western medical practice. How are you able to accommodate and educate so many different cultures?
That's a great question. I think that goes back to the point we mentioned before the break. It's really not inherently about culture, but it's about competence. Okay. It's about being culturally and competently aware and sensitive, being compassionate, and understanding that your needs are needed. I need to respect them. I need to acknowledge that you have a different way of thinking. And so how do I take that and apply it in your care? How do I acknowledge that maybe the way we're thinking about this problem isn't the same, but yet you still need to receive care that you feel is appropriate and that is also competent. And so it's not about understanding all the countries on the globe and all of the cultural nuances with those countries. That's definitely important information, and we absolutely cover that in trainings and as we come out and educate the community as well as our professionals in the health system. But it's understanding the compassion, understanding the need to acknowledge, to listen, to negotiate, and really be for the patient, be focused on the patient's needs, and do the best within your competence to meet them at their needs.
Tell us about the bilingual training program, and I know that's got to be amazing. You are constantly looking for individuals with different language abilities, correct?
Sure. So our Qualified Bilingual Staff Program, or QBS as we call it for short, is a program where we use the talents of our staff who are bilingual, and we reward them for that, both in monetary reward with a small differential, as well as in a good feeling of we appreciate what you're doing. We want to acknowledge that and use that in addition to your normal service area. So we take a staff member who, let's say, is bilingual in Spanish. We test them to make sure that their proficiency in Spanish as well as English is acceptable and on par. And then we train them for 3 days. Over a 3-day period, 3 8-hour days, so it's a pretty extensive training. We talk about how to be a medical interpreter, how to appropriately use your skills to interpret in a medical setting, which is going to be different from other settings. There will be some sensitive things that will be discussed. We'll also have some sensitive topics that may be over your head or just beyond your normal conversation. And so that's part of the testing, making sure that they understand both languages well enough to communicate that to the provider and the patient. And so as we train and talk about that, we also talk about culture and what their role is and why it's so important that they serve as an interpreter, why people need that service and how that helps improve their status in health and in society, how that really makes an overall improvement in their lives, having someone there in their medical setting to interpret information and to do so correctly. And so in that training, we talk about these things over 3 days, and then we send them back to their institutions because we do this training both with our staff at Adventist Healthcare as well as other healthcare systems in the area. And we train them, we send them back to their facilities, and they're then able to interpret in either customer service roles, depending on how their proficiency is in both language of service and English, as well as in medical settings. If their language vocabulary is a bit more expanded, then we train them and approve them to interpret in medical settings.
Do you ever use college students for internships?
We absolutely do. We have a very strong internship program with the colleges in the area, primarily the University of Maryland, College Park. Mm-hmm. We often have about 10 interns every semester that come through that program, their public health program, and they spend the semester with us. And as I said earlier, the Center for Health Equity and Wellness, we are the feet on the ground. We're the hands in the community, touching the community. And so those interns get to be our hands with us. They're out doing the screenings, the health fairs that we have throughout their semester. And so we definitely give them a hands-on approach. This is not a paper-pushing internship. If you come to the Center for Health Equity and Wellness, you'll get some concrete experience. And our interns go on to do great things. Some of them we hire from within, and some go on to do some great jobs in public health that really make a difference in the lives of the community. So we absolutely have a great internship program, and we highly encourage anyone who's interested to apply. Apply early, because we definitely staff them very early, and it's very competitive because of the great experience that we're able to provide.
In case you just tuned in, you're listening to Montgomery Mosaic on 1450 WOL. I'm Ron Thompson. In studio with me is Emmett Martin, Program Manager, Cultural Competency Center for Health Equity and Wellness. Let's go back to the Project Beat It. Tell us what the next steps are for the program, and how can one learn more about the project or about participating in an upcoming training session?
Sure. So the funding cycle has ended for Project Beat It, but we are still trying to keep the beat alive, as it were. And so we still have partnerships and are working with community organizations to deliver the program, deliver the training to their healthcare professionals, as well as to their community patients that come to their clinics or their facilities to receive treatment. We know the importance of Project Beat It and how it has changed lives, how it's helped professionals. We have a number of great testimonials of program participants who have talked about how their practice with their patients have changed 180 as they're able to communicate more readily, more knowledgeably, the information that they've learned to improve health outcomes. One great success story we love from Project Beat It is a woman by the name of Fende, who is actually a registered nurse, and so someone who is a healthcare provider who gets it, but yet she wasn't getting it in her own life. And she was diagnosed with type 2 diabetes, put on several pounds, and was not living a healthy life. But as a result of her interacting with a Project Beat It trained healthcare provider, she was able to reduce her weight, lost about 60 pounds in a year, and made some great improvements. She's off of her medications. And so we know that Project Beat It is important, and so we're always looking for ways to partner, ways to keep the beat alive, ways to keep the ball rolling. And so if there's anyone who wants to partner with us, who wants to learn more about the program and have it come to their facility, please reach out to us. If there's a Daddy Warbucks out there who wants to grant us some money, we'll definitely take that as well.
Oh, that's right.
But we anything to keep the beat alive, anything to keep this project going is so important and so near and dear to us. We've seen how well it's improved lives. We've seen how it's changed the African community for the better. So we are definitely keeping things rolling.
I believe you have a website where folks can go to get more information. Can you share that website address with our listeners?
Absolutely. So our website is www.adventisthealthcare.com/health/equity-and-wellness.
Okay, let's do that one again.
Sure.
'Cause,
It's a lot going on.
It's a lot, and hopefully if you're driving, you not trying to text that in, but do that again.
Sure. So it's www.adventisthealthcare.com/health/equity-and-wellness. And of course, if you did a Google search for Adventist Healthcare and did a search within our website, you should be able to find the Center for Health Equity and Wellness. Similarly, to learn more about our upcoming community events, you can visit blog.adventisthealthcare.com. That's a lot easier, and there's a listing and direct link to our website as well as our community events.
Ahmed Martin, Program Manager, Cultural Competency Center for Health and Equity and Wellness on Montgomery Mosaic. Tell us about some of the success stories.
Sure. So as I mentioned, Fende, great success story, great way to look at how this program has changed a tangible person's life, because it's easy to see the numbers and to hopefully feel that the training has made an effect and an impact. But Fende's life is a great example of that. We've actually done a small vignette that's on YouTube that speaks about her success. Another great success that's come from the program is one named Michelle McBride. She's a registered nurse who has done some great things and really seen a change in the health outcomes for her patients, as well as for her own practice, her own way that she has been able to deliver health care to her patients. She's really felt like her eyes are opened, and she is a better practitioner because of the Project Beat It program.
And let's talk about the Project Beat It program one more time. How do you get the word out about the project?
Well, a part of the word is me. I am probably our best poster girl because I'm so passionate about this program. As the daughter of two Nigerian immigrants, I grew up seeing the challenges that they faced, and they're both well educated. My dad has 2 PhDs. My mom has a master's degree, so they're intellectually, they get it. They understand life, but still the cultural nuances and challenges of being an immigrant in this country and an African immigrant are things that they still deal with, even almost 40 years later. And so understanding the challenges of African immigrant patients, I am probably our biggest cheerleader for why this project's so important. But also our website, as I've mentioned, is a great way that we advertise it. We have a Facebook page, and we also have a monthly e-newsletter. And if you go to our website, you'll be able to subscribe to those things and stay in the loop of what's going on with Project Beat It and our other activities at the center.
So your personal satisfaction working with the program?
What can be said? I don't know if I have the words, but again, it's just I'm so grateful for this opportunity again to do something that's so near and dear to my heart. Again, being the daughter of two Nigerian immigrants who, I've seen them face challenges. I've seen others in the African immigrant community face challenges by growing up as a daughter of immigrants. And so I really love the opportunity to see lives change, to be a facet to improve their lives and improve their health.
Well, this has been fascinating, and we certainly commend you for your work with the Center for Health, Equity, and Wellness. I'm sure your experiences help this community and through Project Beat It and, of course, the Adventist healthcare system. You're going to continue to do a great job. We are in studio with Emmett Martin, Program Manager, Cultural Competency Center for Health, Equity, and Wellness. We thank you for being on Montgomery Mosaic. We'll be back in a couple of weeks right here on 1450 WOL.
Thank you for having me. It's been a pleasure.
You've been listening to Montgomery Mosaic, featuring topics of interest to Montgomery County residents, businesses, and visitors. For more information or a copy of the show, email public information at montgomerycountymd.gov or call 240-777-6507. Be sure to tune in at this time every month on the third Wednesday for Montgomery Mosaic on 1450 WOL, WPRS HD2, and worldwide at WOLDCnews.com.